5 effects of tooth loss. Last week we had a patient walking into a clinic who had extracted her molar tooth about 1 year back, following which she over a period of time developed some pain on her muscles and her joint, and she was seeking treatment from various doctors to sort it out. And then eventually she came to us and we were able to identify what the problem was and how, and then we were able to help her get solution to the problem. So in this particular video, we look at 5 effects of this tooth loss and what are those effects and how does it affect us. Number 1 is effect on the teeth. So when we have a full complement of teeth, each teeth supports the adjacent teeth and also protects the upper teeth. When we lose a teeth, the adjacent teeth don't have any support, neither the upper teeth or the opposing teeth has got any support, and they start moving into the space where the tooth has been taken out. So when there is movement of tooth that happens into it, it disturbs the balance between the teeth, creating artificial gaps between the teeth, and because of these artificial gaps, food can get caught, start a decay and give rise to problem. Another thing that can happen is also because of the food getting caught and gaps there on the decay, the gum also starts receding. Eventually the tooth can become weaker and then we can lose further tooth because of gum weakening. So these are the 2 things that is affecting the tooth. The next is our effect on the bone. When I look at the effect on the bone, the second aspect of it, the bone that holds the tooth is called the alveolar bone. The alveolar bone develops when our tooth forms. So when we remove a tooth, there is no use for the alveolar bone. Because there is no use for the alveolar bone, the alveolar bone starts to get reduced in size. Over a period of time, we are having bone loss. So this further rises to other complications because of this bone loss. So this is the effect on the bone. The third aspect is our effect on our jaws and our musculature. So this is what is important here is, as I was saying in the first point, the tooth is very important for the stability and the equilibrium in which our muscles operate and the joints operate. When we lose a teeth and the tooth moves, the way the upper and the lower teeth joints, there is a slight shift or the slight movement in the way those tooth joints. This happens because of the tooth movement. Now the tooth movement leads to an improper alignment of the upper and the lower jaw. The improper alignment of the upper and the lower jaw eventually leads to some disturbance in the way we open and the close our mouth. So this causes stiffness in our muscles, which opens, and these are called the muscles of mastications, which opens and closes the mouth, also to the joints. Eventually it can lead to clicking in the joints, muscle pain, tenderness over the muscles or tenderness of the joints and clicking of the joints. These are some of the effects that are there because of on our face structures and the muscle. The fourth point which happens is the way our face looks. Because when we lose teeth, we not only lose teeth, we also lose the bone that supports the teeth, also the gum that supports the teeth. Over a period of time, our face structure, the face profile changes over a period of time, making us have an aged look. An elderly appearance or an aged look happens because we lost a teeth. So this is the fourth important aspect of loss of teeth on our face. Of course, the fifth most important aspect is on the overall well-being. So when we have enough number of teeth, when we have the full set of teeth, we are more confident, we speak well, we are able to function well, we are able to eat well. So our body's nutritional demands are met well because of the ability to chew food well, and also because we chew food well, we are able to digest the food well, and nutrients are absorbed well in our body. When we lose teeth, ability to chew food comes down, our confidence also comes down, and overall well-being comes down. So it's very important we take good care of our teeth and not lose them, and in case for some unfortunate reasons we have lost a tooth, it's always better to replace the tooth. I hope you like this video. If there are any questions, please do ask in the comment section below. We'll be happy to answer. This is Dr. Arun from Pearls Dentistry. Until next time, bye bye and thank you. Before we close, do subscribe to our channel Pearls Dentistry, and we've been running our dental centers since the year 2001, and we're coming out with a new video every day. Thank you, Dr. Arun from Pearls Dentistry. Bye bye.
Like the video, press the like button. Do subscribe and click on the bell icon to receive such videos. Thank you.